Hi everyone, I hope that this video is helpful, and I am envisioning in my mind families out there with these extremely cranky, fussy, gassy babies and they don't know what to do. First of all, as always, the disclaimer, if you have specific concerns about your baby, please call your pediatrician. These are just general tips and advice that we hope to offer you to kind of give a little bit of calm to a chaotic situation sometimes. So first of all, I want you to see the video on colic that I already made, and I realized after that even though I presented all the causes of cranky babies, I never did do the follow-up of what to do about these cranky babies. So today's video is for just that baby who is growing, who is drinking, who is peeing, who is pooping, who does not have a fever, who does not have a serious rash, is not dehydrated, is not having difficulty breathing. We're not talking about a sick baby. We're talking about just that very typical crankiness that babies get, which often peaks from 3 weeks to 3 months, as discussed in the colic video. But I just wanted to go over some tips for those cranky babies. First of all, in your mind, try to think of all the things the baby could possibly need, particularly if the baby is breastfeeding. You know, we're all about paying attention to the baby's hunger cues. Always feed the baby if you don't know what else to do. That's almost always, in the infancy, you know, in these first few months of life, almost always the right thing to do. Now, if you know your baby just fed very well, you know your baby was burped, you know your baby has a clean, dry diaper, and there's no fever and there's no rash and there's no dehydration or no other concerns, but it's still screaming. And what do? This is what this video is for. So do your mental checklist first. You've done all the things you can do and the baby is still screaming. I do give you permission if you need to set that baby down for a minute and go take a break, eat a snack and come back to it. That's okay. You're not going to damage the baby from crying. We just worry that they'll swallow more air as they cry and then could become more gassy. So you're also not going to spoil the baby just by holding it. But some strategies that you can try. Let's talk about things. There are gas drops on the market called simethicone. One of the most common brand names for that is Milacon. Let me assure you that these are perfectly harmless. It is okay to give them to your baby. Here's the part that's a little less firm. They've never been proven to actually make a difference in large studies. So we approach them on a case-by-case basis. If I have a set of parents who say, these drops help my baby, and it's fabulous, well then great, add them to your checklist. Fed the baby, burped the baby, changed the baby, gave the baby some gas drops. We've done all we can do. That's fine, because they're harmless, but they're also not proven very effective in larger studies. So then another thing similar is gripe water. Now there was a little bit benefit of the chamomile. I think I read one study about that years ago, but for the most part not hugely effective, statistically speaking, on large studies. The only thing, but again, harmless. So if you feel gripe water helps your baby at the recommended doses, again, it falls under sort of a homeopathic category, so it's not necessarily monitored by the FDA and that sort of thing, so we don't wholeheartedly endorse it, but it's probably harmless. That's fine. But the only thing in a large study that was found to be helpful for colic-type symptoms, which are the scream until their face is bright red, tight feeling tummy, knees drawn up, difficult to console, seem to be very gassy, very cranky. The only thing that was shown to improve those symptoms was the use of probiotic drops. The reason we think that works is, think about the baby has gas in their belly, right? Well, certain bacteria, the beneficial bacteria that live in your intestines, produce less gas than others. So it would make sense if we could populate the baby's gut with beneficial bacteria, maybe it would produce less gas. So certainly I would recommend the use of probiotic drops. And it's not going to be an immediate benefit because it's going to have to stock up that population. It may be a week before you start seeing much of an improvement, and it's not 100%, it's just some improvement. So first of all, the most important thing about having a cranky baby is to absolutely not shake the baby. So I have a volunteer baby doll to use. Thank you so much. This is my very beautiful volunteer baby doll. So I want to tell you about some of the things you could try to soothe your baby. You could try just walking while you pat to get some gas bubbles out, and you could jiggle and you could sway. They always, my Langdon law of colic is they demand the absolutely most energy you can expend. So if this were a real baby right now and I'm sitting down, that would not be okay. I would have to be standing and walking the floor while swaying and patting the back and jiggling and doing everything I could. Also, some babies soothe well to hold them forward facing and hold their hands together with your hand under their little butt, and then you can just walk and kind of sway them like that. Sometimes even in the air, they like that a little bit, as long as you've got adequate head support, depending on the age of your infant. Many babies will soothe to a warm bath once their umbilical cord's detached. Many babies will soothe to a tight swaddle, some don't. Many babies will soothe just to be held, so you're not spoiling them. It's okay to hold them. The absolutely only thing that would be wrong to do is to shake your baby forcefully in a back and forward motion. And so that would be something like this, very hard with inadequate head control when their head's moving rapidly forwards to back. That's very bad and could cause permanent brain damage. Thank you so much for my little model. And so you can swaddle, you can alternate the baby's placement in a bouncy seat with some vibration setting on there. You can put the baby safely in a car seat and go riding around in the middle of the night if that vibration and warmth and motion seems to help soothe them. That's totally fine. You can call grandma and she might want to come over and take a turn in the recliner holding the baby just because it soothes to be held. That's fine. I just want to give a word of encouragement to all you parents dealing with these screaming fussy babies. Take turns. Don't be too proud to call in your help to come give you a break. Have a date night. Most grandparents are thrilled to be able to help you in situations like this. Use your friends, use your neighbors. As long as they're healthy and vaccinated and safe to be around the baby and wash their hands carefully and they're not currently sick, it is fine to use help, even though under 2 months, of course, we're still avoiding crowds to avoid any chance of infection or fever. So use your help, take breaks. And remember, this is the best news all night, is remember that the baby is going to outgrow this. This is a temporary phase. By 4 months, all the babies that I see at the 4-month well, they're smiling, they're cooing, they're interactive, they're giggly, they're amazing. 4 months is the greatest. So you just have to hang in there, because this excessive fussiness, crankiness, gassiness, it's all temporary. You are going to get through this. So I hope that was encouraging and helpful. Thanks.